It shut down the world and killed hundreds of thousands of people. A virus that has affected every country and forced us to reassess our lives. But out of the crisis have come lessons and a chance to improve our scientific knowledge. Tonight on Sky News, our medical life after the pandemic and our new world. A very good evening, I'm Dermot Menahan, and over the course of this week I've been speaking to some of the greatest minds in politics, business, culture and tonight's science. Joining us again tonight, a new live virtual studio audience from all around the world who will be asking questions about how we can build a new future. Look at them wave, looking forward to hearing your questions. Now facing them, the director of the Wellcome Trust and a member of the government's SAGE committee, Sir Jeremy Farrar. We've also got the former commissioner of the US Food and Drug Administration, the FDA, Dr Margaret Hamburg. Very good to have you. Joining them, Dr John Nkengasong, director of the Africa Centres for Disease Control. And our quartet is completed with Professor Dame Sally Davies, the former chief medical officer for England. Welcome all. So, with the world forced to confront the biggest health crisis in generations, tonight we look at the future of science and medicine.
The coronavirus has hit the UK.
Is that really what it looks like?
One British man who likely contracted the virus in Singapore. He then travelled to a French ski resort, then returned from France to the UK.
We don't know the source of the outbreak, and we don't understand its severity.
The first confirmed death in Britain from coronavirus.
Stay at home, protect our NHS and save lives.
This used to be a theatre. Just how much has been cancelled and sacrificed.
My wife isn't allowed to come with me anymore, and I miss them terribly.
These NHS workers who lost their lives were all at a greater risk.
As a community, we are put at risk every single day.
For a mother then to not be able to grieve, it's unimaginable.
Allah. And how those death tolls have grown.
World Health Organization now says the coronavirus outbreak is a pandemic.
NHS staff are risking their own safety.
I understand people's anxieties on the front line.
If they don't do something really quickly for the care home, God forbid, they are going to die.
They want to discharge people, but they don't want to test.
Sometimes I'll sit in a bath and I'll cry.
The Prime Minister has been taken into an intensive care unit.
The NHS has saved my life, no question.
This is a very easy way for me to support the cause.
This is probably the biggest step forward since the crisis began.
Government wants to rely on self-reporting rather than tests.
I just thought I might die. Thank you. I'm not going to cry because you've looked after me so well.
The world's health systems and our view of the science behind them, tested to the limits. So let's dive straight in. Let's get our first question from our audience tonight. This comes from Lindsay Forbes, who's on the Costa Blanca in Spain. Good evening, Lindsay. Please kick us off with your question.
Good evening, Dermot, and good evening, panel. My question is this: will there be an effective vaccine, or is it more likely that we will need to find effective medical treatments, as was the case with HIV? I have another reason for asking this question. The world needs an effective vaccine, but the fatality rate for the old and compromised is frighteningly high. We need better treatments as soon as possible so that people are no more worried about catching COVID than they are about catching the flu. OK, so right into the meat of it. Vaccines, and short of that, a treatment or treatments. Let's kick off with Sir Jeremy Farrar then, and a very good evening to you. Well, let's talk about vaccines first of all. We hear about these, well, I suppose they're up into the three figures of testing and trials and development going on, and some of them, a large handful, are now in human trials. Are you confident we're going to get a vaccine soon?
Yes. What soon means, I don't know. And I think the question that's come is absolutely the right question to ask. I was a junior doctor at the start of the HIV epidemic in the mid-1980s. And of course, at that time, we also thought we would have a vaccine. I spent a lot of my life working on tuberculosis and malaria. And the truth is we still don't have vaccines for those diseases either. We cannot put all of our hopes on a vaccine. Yes, I'm optimistic. Yes, the science is progressing incredibly quickly all around the world, including here in the UK. But we cannot assume we'll have a vaccine. We don't know when we'll have it, and we don't know when it'll be accessible to everybody who needs it wherever they are in the world. So the question is really well posed that we also have to push on with research on diagnostics so that we can make diagnosis quicker. And we also have to press on with trying to treat so that we develop drugs that can both prevent this infection, and if you are unlucky enough to catch it, that we can prevent you getting more sick, going into hospital, and tragically dying. So we have to do all of those as well as the social science, and we cannot assume that any one of those will deliver what we need for this infection.
Well, Dr Hamburg, I saw you agreeing with Sir Jeremy about a vaccine. Hope for it, but can't depend upon it. So let's talk more about those treatments. And because you're in the United States, we've heard a lot from President Trump about treatments like the anti-malarial one, hydroxychloroquine, even bleach. Well, we'll leave the second one out, but could there be a repurposed drug out there?
Well, it's very important that we move forward on all tracks and that we harness the best possible science wherever it is to advance our forward movement towards both drugs and vaccines. With respect to drugs, there are a number of different strategies that are underway. Finding an old drug that can be repurposed for the treatment of this novel coronavirus and COVID-19, the disease it causes, would certainly be one approach, and it would be quicker because those drugs already exist, and we know a lot about both their safety in humans, and we know a fair bit about their mechanisms of action in many cases. But most likely, the drugs that will really prove most beneficial will be ones that will be developed specifically to address this particular coronavirus and our understanding of how the virus causes disease in people and how our immune system responds to the disease. But those drugs are going to take longer. And we also have to recognize that just like with HIV/AIDS, we probably won't just have one drug that will do the trick. We will probably have a combination of drugs that will help us to interrupt various critical points in the life cycle of this virus and also how our body responds to it. So I think that, we're looking at long-term efforts, but we may have some things that will provide some benefit sooner rather than later. And we're beginning to see that happening. And of course, the goal is also to have treatments that can be used outside of a clinical care setting to treat and prevent, limit the symptoms and the course. Just like with flu, we have an antiviral drug that can help us to reduce the course of the disease, the seriousness of the symptoms, so that it becomes much more manageable.
OK, well, listen, I'm going to talk to our other two panellists in a moment or two, but I just want to bring in our audience there. I saw some of you nodding along there as you were hearing those opening comments from Sir Jeremy and Dr Hamburg. And I want to ask you, can you take part in a straw poll for us? We've been doing these every evening. It's just a show of hands. It's just indicative, but it's about a vaccine. We heard Lindsay saying how important that is, and short of that, some kind of effective treatment. So I want to ask you, by a show of hands, how comfortable will you be returning to something like normal life if no effective vaccine is developed? So there's no vaccine. Will you be happy returning to something approaching your normal life? Put your hands up if you would. Well, maybe half, something like that, with no vaccine, but hopefully some treatments along the way. Well, let's feed that then into our discussion. And Dame Sally, a vaccine, is that then the icing on the cake? Are treatments out there that you think can help? And indeed, things like have been mentioned during the course of this virus, vitamin D, even tobacco patches.
I don't think there's any proof of any of those as yet. And I wouldn't recommend nicotine patches, as they are used for stopping smoking, and nicotine's addictive. I do think that we have to remember that we in Britain and across the world have been flattening the curve, as people talk about it, by infection prevention and control, by washing our hands properly, by, I hate this one, respiratory etiquette, you know, blowing your nose, being careful, not coughing on people, many people using masks so they don't transmit, and actually the lockdown, protecting the vulnerable by staying safe. And so that will remain the backbone. And there are many other advantages to exactly that, to taking these infection prevention and control efforts. Our flu season this year finished early because we were so successful. We will get fewer bacterial infections as well. We will see fewer infections in general. That'll keep people well and out of the NHS. So while we wait for all this hard work from laboratories and scientists, don't forget, we have a major role to play.
Dr Nkengasong, very good evening to you. And can I ask you from the African perspective, how high up the agenda of vaccine development is one for COVID-19? Presumably it would be more use to Africa to get one for something like malaria.
Absolutely. The continent as a whole is extremely engaged and concerned with issues related to access to COVID-19 vaccines when they subsequently become available. We're part of those who signed a declaration that was published in Financial Times just the other week. They're calling for a people's vaccine, which means we are mindful of the fact that access to vaccines when they become available is critical for a continent of 1.2 billion people. We always remind ourselves of what happened in 1996 when HIV antiretroviral treatment was available, but it took so many years before it became available on the continent of Africa, and so many lives were lost due to that. So I think the continent is extremely mindful and concerned with that. The Africa Centers for Disease Control and Prevention and the African Union Commission will be convening a meeting in the next coming weeks to continue to have a dialogue on access to vaccines when they become available. And we are concerned with the entire spectrum of vaccine development, that the continent should play an active role in vaccine research and development, as well as clinical trials, as well, not just be a passive recipient of vaccines that will be developed.
Dr Hamburg, I want to ask you about that, about availability of a vaccine if one is developed. And you heard there Dr Nkengasong saying how crucial it is that Africa would have access to one. But some indications coming from President Trump that if there were one developed, it would be, once again, as in so many things with the president, America first.
Well, certainly he has indicated great concern about making sure that we move forward as quickly as possible to develop a vaccine, and we make sure that we have manufacturing capacity here in the U.S. It's crucial that he and our leadership in this country understand, though, that this is a global pandemic and that our safety as a nation depends also on addressing this problem wherever else it is in the world. It's also crucial that we appreciate the fact that science is a global enterprise, that collaborations with scientists around the world and working to advance vaccine research and development is going to be a collaborative process, and we will do better, and we will end up with more opportunities to have a vaccine that's safe and effective, and more opportunities to manufacture it in large numbers if, again, we work collaboratively. Moreover, studying this vaccine is probably going to require an international effort, because this outbreak, this epidemic and pandemic is moving to different places around the world, and you need large populations to study it. So while we sadly have many, many cases now in the US and lead the world in that, we may not be able to only study it in our country if we, in fact, continue to make progress at reducing the disease. And finally, we don't know where the first vaccines are going to successfully be developed and cross the finish line into the marketplace for use. And we don't know whether any of the efforts in any one country will be ultimately successful. So again, even if you're thinking selfishly about your own citizens, you need to be thinking globally and engaging as well, because access to something developed somewhere else may actually prove critical for the protection of citizens. So we are hoping, as we always have in the past, that the U.S. will provide critical leadership for developing the science and technology needed to get one, hopefully more than one, successful vaccine produced in this country, but that we will do it in a spirit of engagement and collaborative concern about creating a safety net around the world through vaccine protection, and really a global effort.
And collaboration is something we're going to be discussing throughout the course of this evening. But I want to get to our next questioner, another vital question coming up from our virtual audience. This is from David Henderson. David, I know you're in Guildford in Surrey. Would you please put your question to the panel?
Yeah, good evening, Dermot and distinguished panel. Do you believe that we still run a serious risk of a second wave or a future mutation of COVID-19, maybe called COVID-20, later this year? And if so, are we, by that I mean the government and their agencies, prepared or preparing for such an eventuality? And what might have been done differently in the present crisis?
Ooh, OK. COVID-20, the second wave, much discussed, much feared, of course. And while we're on waves, Dr Nkengasong, I want to ask you, first of all, about how Africa has dealt and is dealing with the first wave. Much comment being made. There were fears before it came, before it affected Africa. You could see it coming. There were many fears because of the state of health systems, that it would really wreak havoc within many African countries. And at this point, it doesn't seem to have been the case.
I think we should be extremely careful when we look at the numbers and interpret our numbers in Africa. As of this evening, the continent has reported about 157,000 cases, and that is up from last week about 30%. So the pandemic in Africa delayed because we took very early measures. I mean, in terms of coordinating actions at the highest level of the continent. And then secondly, countries went into lockdown very quickly and shut down movement and their economies. But now they are beginning to unlock that, and we see that there's been a steady increase in the number of cases over the last couple of weeks. And that's also true with the number of deaths. We are at about 4,500 deaths reported across 54 countries on the continent. So it is a delayed pandemic, and there's absolutely no doubt that it's gaining momentum. So we should absolutely be very, very careful with that and continue to intensify our efforts. The other thing we should remember is that our testing capacity is still very low. If you compare Africa, a continent of 1.2 billion people, and then you square that by the number of tests we've conducted, it's really very limited. I mean, we've conducted about 1,600 tests per million people. So if you compare that to the number that of tests being conducted in the UK and other United States, Italy, is really, it requires a lot of efforts there. So again, when we interpret the numbers on the continent, we should really understand that we need to expand our testing as much as possible. And that's why we have launched an initiative called PAC, the Partnership to Accelerate COVID Testing on the continent, to increase that number of testing to at least 12 million to 20 million in the next coming 3 months, so that we at least it allow us to be ahead of our pandemic. So again, it's a word of caution that the continent had a delayed pandemic because we observed it happening in China, in Europe, and the United States. The first cases were reported on the continent around February 14. We had time to prepare for it, and but now we are seeing an increased number of cases.
Well, that is fascinating insight. Thank you very much indeed for that. And so, Jeremy, second wave of COVID-19, and should we also be preparing? It was contained in the question from David there as well. We learned today, I'm sure you've known about it for an awful long time, something like 1.7 million viruses in animals that could potentially get into humans. We've got to be worried about them, haven't we?
Yeah, we do, of course, and I'll come to that in a second, because we've got to worry about COVID-19 at the moment, or COVID-20 as it's just been called. I think at the moment, of course, UK is still in its first wave, as we've just heard from John. Africa is just starting to go into its first wave, and much of Europe, thankfully, is coming off the peak of that first wave. But I think at the moment we have to plan, and we have to assume that a second wave is coming. As Dame Sally said earlier, the lockdowns, the hand washing, the physical distancing, the care for the vulnerable has suppressed this virus, and it's suppressed it. The numbers are coming down, thankfully, finally. But it's not changed the fundamental biology. It's not changed the fundamental way this virus goes between me and you, the transmission. So we've suppressed it, but we haven't got rid of it. And this is now a human endemic infection, in my view. And in the UK and in much of the world, actually only about 6 or 8% of people have seen this infection, and we hope are immune. That means that over 90% of people have not seen yet this infection and are probably still susceptible to it. So the vast majority of every population in every country in the world remains susceptible to another infection. So if this does come back in a second wave, many of us, and I think myself included, would still be at risk of getting infected. And that is the coming of a second wave. And what countries all over the world have got to do is learn lessons from the first wave, put in place things that, we didn't get right in the first wave, we should admit that, and make sure that when we come into the autumn and the winter of this year, when other infections, influenza, will be circulating as well, we have everything we need in place so that we can reduce the impact of that second wave. And that is what we should all be planning for at the moment. And we should not underestimate the power of this virus to come back in a second wave.
Professor Davies, what are your thoughts on that? Some say it could go, COVID-19 could go the way of SARS or MERS, other coronaviruses that seem to disappear and not come back.
Well, so far, the countries that seem to have got rid of it then still have cases popping up. And while it's rattling round and round the world, it'll be very difficult to get rid of. If you think about flu, it is in the northern hemisphere, then it goes to the southern, it may mutate, but then it comes back round. And it just goes round year after year with different strains and different changes. I absolutely agree with Sir Jeremy. It's not gone away in Britain. We need to continue with the planning and the work that's happening, because though I'm not a forecaster or a modeler, I would prefer to be prepared for a second wave and even maybe a third wave. When we look back at 2009-10, the mild flu pandemic, we had 3 waves. And so we can expect more of this. The question is it a big wave, or is it, because of the way we handle it, lots of little waves? It'll go on until we are immune.
Well, let's reveal some of our polling. All week we've been revealing the results of a wide-ranging opinion poll that we conducted for these programmes about the future facing the world. Now, this is one of the questions we asked. Will the pandemic lead to health services in Britain getting better or worse? And these were the results. 43% of those surveyed told us they thought health services would be better. 8% thought they would get worse, and 34% thought there wouldn't be much difference. 15% said they actually didn't know or didn't have an opinion on it. So will health services improve after the pandemic? Let's bring in a member of the virtual audience. Once again, somebody with some expertise in this area. Wendy Noble is a doctor working in Dubai. Very good to talk to you, Wendy. And what is your question?
Hello, good evening, panel. My question is when and how are we going to address the hard question of managing those people and in the population who persist in unhealthy living practices that promote ill health, such as obesity and smoking? Both of these cost our NHS a huge amount of money, and we don't have unlimited finances. And in fact, now they're getting slimmer by the day. So how are we going to provide medical care, especially after the pandemic?
Okay, a very good question. I'm going to put some of those thoughts to our to our audience for a show of hands in a moment or two. But let's just address that question and indeed the original polling there. And Dr. Hamburg, there are a lot of people thinking, in actual fact, health services will improve. But given the stresses and strains they're under from coronavirus and then the more long-term strains of things like an obesity crisis, can they really improve?
Well, this is going to be a very challenging time for health as we move through this COVID crisis to whatever new normalcy we have. And of course, getting through the COVID crisis is our current and acute challenge for the medical care system and for all of us. But I think we need to really think long and hard about this and really recommit to making sure that we can provide the care that is needed for people on a routine basis and in a situation of crisis. Our system of healthcare in the US is, of course, very different than what you have in the UK. And frankly, in a situation like this, and at other times, I have often looked with admiration to the UK system because it is more coherent, and it really is a system whereas ours is very fragmented, and there are many more people who can fall through the cracks. But I think that we have learned in this country, and I think other countries have learned as well, about the importance of doing a number of things as we think about how to promote health and prevent disease, even in a situation like this. One is we need to make sure that our health care systems, our clinics and our hospitals are adequately equipped, and that our healthcare workers have what they need, the tools they need to be able to do their job. And it's been painful for us to watch our frontline healthcare workers have to go in and take care of COVID-19 patients without the personal protective gear that they needed, without the ventilators for support, without even the tests that they needed to be able to assess patients and manage their care. But it's also been difficult to see how our system has not really supported patients to be as robust in their health as the questioner was asking, as they were forced now to address this additional health crisis. And without a doubt, some of the most vulnerable patients for COVID are those that have other underlying medical conditions, chronic conditions like obesity and diabetes and hypertension certainly add considerably to the risk. And I hope we will go back and recommit to making sure that we can provide care. Okay. I think we've also learned a lot about how to use non-traditional tools of care, telemedicine and home-based care and digital tools, and we need to integrate those into our ongoing healthcare as well. So I think healthcare will look different as we move forward. Hopefully, it in many ways will serve patients better, and it will also focus more on prevention and not so much on treating problems once they are entrenched.
Okay. Well, that's the perspective from the peak of the developed world. What about the developing world, Dr. Nkengasong? We know that in some countries in Africa, health services very stretched, pretty scarce to a lot of people. What do you think then about the issue of rationing, perhaps?
So besides COVID, before COVID, the continent was already challenged with multiple diseases, HIV, tuberculosis, malaria, and the rising rates of non-communicable diseases, diabetes, hypertension, and challenges due to access to immunization. So COVID has further compounded and will continue to make those situations look extremely difficult to handle. So our health systems are fragile. We were managing and struggling to build those health systems. But the COVID, now we've learned a lot from West Africa during the previous Ebola outbreak. where 11,000 people died. And we learned that many people died because, not necessarily because of Ebola, but because of the effect of Ebola on the health system. So we are extremely concerned what will happen to our very fragile health system in the presence of COVID. As we speak today, there's a country like the Democratic Republic of Congo is dealing with a new outbreak of Ebola, which just happened 2 days ago. We had an ongoing Ebola outbreak, which we have been working very hard with the World Health Organization and the government of the Democratic Republic of Congo for the past 2.5 years. We have in the same country issues related to outbreaks of measles, cholera, and malaria. So issues of the COVID infection compounds a huge number of other health problems and crises that we're already dealing with there. So we really need to step back and have a comprehensive discussion as to what is our strategy as a continent to build a health system and consider that that's truly an economic and health investment and not necessarily a cost to the countries. I think a bold vision will need to be developed for the continent in order to get rid of these fragments and silos of vertical diseases.
OK, well, we've got somebody else who's got some input, I'm sure, on this, and that, is, of course, is our questioner. Let's go back to Wendy, as I say, a doctor working there in Dubai. And Wendy, to put your own question to you, what's your view on it in terms of those who persist in unhealthy living practices which promote ill health, such as obesity and smoking? Are they less deserving, then, of precious and scarce health resources?
I don't think you can say that, because that's not actually a humane or sensible way of going forward. And these people are actually deserving of healthcare just like everybody else. But I'm here in Dubai, where obesity and smoking are huge issues, with a large proportion of the population here being diabetic. Now, obesity worldwide is an enormously burgeoning problem. And one of the things that support it, the fast food and all the rest of it, are actually a major problem. We've seen queues stretching down to the other side of town practically on the television from McDonald's, images from the UK, and we had the same thing here. I mean, it's no different. But it's interesting. I wonder whether the lack of fast food in the last few weeks has actually contributed to better health. Maybe, I don't know. I mean, nobody's obviously studying that. They're too busy looking after COVID.
Indeed.
But
well, let's.
If we know.
Yeah. Sorry, Wendy.
If we know that people.
Sorry, Wendy. I want to involve you and indeed the other 49 members of our audience to stay on this very subject. What an interesting debate it is. And I want to take another of these straw polls. A show of hands is all we require. And I want to put this question to you. Should there be financial penalties or maybe restrictions of health services to pay for the care of those who put their own health at risk through smoking or overeating, for example? Raise your hand if you think people should have to pay for something like that. What do you think? Well, certainly over a third, and probably less than a half. Thank you very much indeed for that. Well, let's throw that into the debate. And Sir Jeremy then, and back to COVID. I mean, COVID-19 has given us a public health message. We've seen that in the mortality figures, haven't we? In particularly when it comes to obese people and people who develop type 2 diabetes as a result of their obesity. They are more at risk.
Yeah, they are, as are the elderly. I really get worried when I hear ideas that you're going to isolate certain groups and you're going to treat them differently. I can't sort of come to agree with that myself. I would, because she won't say it, but I would give praise here to Dame Sally Davies, because in her time as the Chief Medical Officer in the UK, she fought incredibly hard to shift healthcare in the UK from a hospital-based to a preventative, to strengthen public health, to shift our behaviours into more healthy eating, reducing smoking, taking more exercise, and all of the things that we know are good for us, but we sometimes don't take on. I would like to see that pushed further, whether I think incentives work better than disincentives. So I think as we come out of COVID and we learn the lessons for public health and also pressures on hospitals, and almost every country in the world is, of course, aging and the demographic shift that's going on. We've got to rethink how we support public health, how we support prevention, how we prevent the comorbidities of diabetes, obesity, strokes, cardiovascular disease, cancers, etc., many of which are linked back to our behaviours. And I think that's going to have to come through, yes, all of us changing our behaviour, but also the country putting incentives in place to encourage, to push us in those directions, and to help us make better choices so that we eat less salt, we eat less fat, we take more exercise. And I think we're going to have to rethink how we're encouraging that to happen. And Dame Sally did an amazing job at CMO in pushing that agenda, and suffered in the media for it.
Well, we'll get Dame Sally's reaction to that in a moment or two, but we've got another question from our audience that will feed into that. And this one comes from a medical student, Rakshanda Sadavati in Telford in Shropshire. Very good evening to you, Rakshanda. What would you like to ask?
Hello, and hello to the experts. My question is, as the coronavirus pandemic has challenged our healthcare system like never before, what can we do to make our NHS stronger?
Right, so what can we do to make our NHS stronger? Well, we have been discussing that, and Dame Sally, as Sir Jeremy was saying, and I remember interviewing you just before you left the job, you talked about particularly obesity, but it is one thing for sure that will strengthen the NHS is a preventative strategy.
So let's start with your polling you've done during the week. 43% thought that it would be better, the health service afterwards, and only 8% worse. And you know, there are some wonderful things going on. It's not just the response that these great staff and all the key workers are making, and we now recognise it's not just doctors and nurses. The wonderful story on one of the television programmes when a cleaner was asked, "What are you doing?" And he said, "I'm reducing the risk of coronavirus. I'm part of this." I mean, they're doing a great job. But we're also seeing that community care and GP care is now much more digital. We weren't getting there before. And then overnight, and don't we all like it? It's much better. It's much easier to get your repeat prescriptions because of digital. There's so much happening. And what we've got to do is bake all of that in, because actually, it saves medical time so they can do other things, and we never have enough doctors, but it actually is better for patients. Clearly, we've got to start to put, and it's happening across the country, ordinary patients or patients without COVID back into the system. We need to know that they haven't got COVID and then get on with treating them and doing the things they need. And yes, we are going to, as the Prime Minister has promised, have to address obesity. And it's really complex. As I said in my former Chief Medical Officer report published on October the 8th, unhealthy food is in the spotlight. And we live, particularly our children, in this flood of unhealthy food. And we've got to kind of dam the flood and take the spotlight off and help families understand. And it's not easy. I know to maintain my weight takes quite a lot of determination, and I know how important it is for my health. But we've got to make healthy choices the easy choices. And in that report, I laid out what we have to do. And there's no one silver bullet. And exercise and biking matter, but they are not the silver bullet. It is calories in, and we need exercise too. So I hope that we can look to a renewed debate about this. I know that the parents want their children to be supported and protected. And I think what we're seeing with the comorbidities and the story about how obesity doubles the risk of death if you get COVID means that others will want help. But you can't do it just by going home and starving. You have to be supported, because this is a lifestyle change that is not easy.
OK, another question our audience bursting to ask them. Another question, this time from Indigo Lani Lewis-Jones, who's in Bridgend in South Wales. Indigo, let's hear your question, please, and good evening.
Hi to hi panel. I hope you're all doing really well. Have there been any new technological advances due to the increased research during the pandemic that could be applied to other diseases or viruses? Will there be new information that can help the diagnoses or treatment of conditions other than COVID-19?
OK, well, have there been any new advances and will there be any new information? So now and the future from Indigo. So, Dr Hamburg, I mean, have there been, or is it too early to tell, even for the rapid scientific research that's been going on, too early to see anything that would perhaps help in other areas? But will there be? Could there be?
Absolutely. And we are already seeing some of it happen, even though we're only some 4.5 months into our experience with this new disease. Some of it you were just hearing about. Professor Dame Sally Davies was talking about digital health and, really developing both new tools and applying in a more meaningful way existing technologies to do telehealth and at a distance care, and that is technology. And importantly, in the areas of medical products, testing, drugs, vaccines, we're seeing real innovation. In the vaccine area, where we started off our discussion this evening, we are really thinking in new ways and applying new approaches to vaccine development and how to get the immune system to respond in a protective way against infection. And some of the vaccines that are in development are novel vaccine strategies that have never been used before. And we're also starting to rethink manufacturing to really modernize it, because sadly, we have not applied some of the available and existing tools of advanced manufacturing to areas in biopharma. We're also seeing, new types of drugs being developed, and we're seeing new scientific technologies being applied in diagnostic testing, including genome sequencing. And in fact, it was the sequencing of the genome by the Chinese, and they're posting it early in January, that allowed us to get quite a head start on development of new medical tools, because we knew what this virus was all of a sudden at a level that was quite profound. And a decade plus ago, that would have simply been impossible. And we're seeing the application now of gene editing to the development of diagnostics as well. So there's a lot of exciting harnessing of existing science and technology and really trying out new innovative approaches as we seek to move as quickly as we can to finding better ways to treat, care for, perhaps cure or prevent this devastating disease.
Dr Nkengasong, it would be very interesting to hear the research that the Africa Centres for Disease Control is overseeing. And do you see within that research potential for any spillover?
Absolutely. I think I'm happy you bring that question up. Before the COVID-19 pandemic, there was perhaps one country on the continent of 55 member states that was producing diagnostics, that is Morocco. But as we speak today, there are at least 4 countries on the continent that are beginning to develop diagnostics for COVID-19. And I'm very convinced that after this development, many more diagnostics will show up. And that is Morocco, Senegal, Kenya, and South Africa. I think this is what the continent needs. I mean, the fact that we're extremely challenged with respect to access to diagnostics speaks to the fact that the continent has to engage in a very deliberate manner to develop diagnostics and engage in a very deliberate manner to begin to develop and conduct research in vaccines and clinical trials. So I'm very positive, optimistic that after the COVID-19 is over, many countries or institutions on the continent will begin to develop that capacity to produce diagnostics.
So, Jeremy, your thoughts on that? What are you seeing? What are you hopeful about?
I think when you firstly on the NHS, I think when you come out of crises like this, it forces everybody to reevaluate. What worked, what didn't work, and what can you do to make an NHS really functional for everybody. And so we'll face a choice to do that afterwards. On the science side, I think my most hopeful thing, which will also, I'm quite sure, happen, is that the interest in this, and it has captivated the whole scientific world, that will draw into the whole area of infectious diseases, of vaccines, of drug development, of immunology, all of the things we have to understand, animal health, ecology, social behavior, psychology, everything. It will draw another generation of young people into that, just as people were drawn actually at the start of the HIV epidemic. And it was those young people coming into science that actually provided the answers in the end to the HIV epidemic. And it will be the same with this pandemic as well. When you have something like this, it galvanizes people, funding flows into it from research agencies, and young people come into it. And inevitably, it's young people that disrupt science and provide the benefits for tomorrow. And I think that's my most hopeful thing that I think will come out of this.
And it is really a very good reason to be hopeful. Listen, we've got time, I suspect, for one last question from our virtual audience. For this one, we're going to Argentina, Mar del Plata, Victor Landolfi. Victor, very good evening to you. What would you like to ask the panel?
Hello, everybody. Considering that there has been some kind of global scientific coordination to tackle coronavirus, the question is whether some kind of global agreement could be reached to deal with the problem of environmental pollution.
OK, environmental pollution, because we've seen cooperation and collaboration on this issue. And Dr. Hamburg, that's precisely what you were talking about when we first started chatting. So I suppose if it were left to scientists, the immediate answer for Victor is yes. But of course, when it comes to the environment, to the climate, it's about governments as well. And that's a different kettle of fish.
Well, that is certainly the case, that science and politics don't always align in terms of identification of what needs to be done and how best to do it. But picking up on Jeremy's hope in the future of science and broader participation, I hope that this pandemic will remind people that science and evidence really matters. We have known for decades that we were vulnerable to this kind of a global pandemic. It was not completely unexpected. The gaps in our preparedness and response, I think, were more unexpected. But we, in a way, with the issues around climate change, are seeing a slow motion pandemic unfold. The evidence is there. We can see already the impacts of climate change in terms of severe weather events, extreme heat episodes, in terms of changing vectors of disease, in terms of damage to agriculture and food and water supplies. The evidence is there about what is worsening climate change and what are the accelerants, and the evidence is there about solutions that can make a difference. And even during this brief period of sheltering in place and the reduction of many kinds of industries, car traffic and other activities that cause pollution, we've seen dramatic changes in air pollution in our cities and rejuvenation of aspects of our environmental the context. So I hope we can learn, people can understand why science matters, the critical role that applying science and evidence to meaningful, sustainable solutions can make, and that we will really galvanize so that we can address clear and present dangers and future vulnerabilities in a much more lasting way.
OK. Well, Dame Sally, I'd like your broader views in a moment or two, but seeing as Dr. Hamburg mentioned the mix of politics and science are perhaps not going too well. Let me ask you about your views of your immediate successor, Chris Whitty, when he appears at those news conferences with the Prime Minister and others. Some saying he's being used as a bit of a human shield, well, a scientific shield for the politicians.
Well, I'm not on the inside any longer, so I can't judge. I can tell you he's a great doctor, and I'm glad he's there on all our behalf. And for me, he's got the energy of someone 20 years younger than me. So none of us get everything right. I think he's really doing a good job.
OK, well, what about the environmental aspects? The fact that we've seen this unprecedented level of rapid collaboration, can it be applied to something like that?
I think we're all learning from that. I mean, I'm enjoying seeing some of the videos and actually outside, the birds. The lack of asthma, the clean air, the blue sky looks bluer. I think that wakes us up to the problems that there are from environmental pollution. I'm particularly interested in pollution of our waterways with antibiotics and other chemicals, but particularly antibiotics. And it's going to be a hard slog to get change, because not only do we need international collaboration, but people have to sort out COVID and then think, so what, as we come out of COVID, can we do more? And at the moment, collaboration is on other things than COVID is proving hard work.
Well, Sir Jeremy, of course, COVID has an environmental linkage, doesn't it? Given we know it's come from animals, potentially from bats to humans. And we were talking earlier about these zoonotic diseases.
Yeah, and if you look back over the last 25 years, almost all of these emerging infections have come from animals. They've come because ecology is changing, the environment is changing, the way that humans, animals interact is changing. People are then now living in these huge cities, tens of millions of people, and of course those cities are now very connected. So that combination of ecological, environmental change, animal-human interface, big cities, and travel and trade. That's what's driving this 21st century phenomena of these emerging infections. But if I could just broaden it out a second, and you look at the great health challenges, in fact, the great challenges for humanity in the 21st century, and we could argue what they are, but for me, they would be climate change and the impacts of that. They would be drug resistance, which again, Sally has done such a lot for throughout her career. They would be emerging infections. They would be the coming of the non-communicable diseases that John mentioned, and of course, mental health. And if you look at any of those, they're all going to need global cooperation and collaboration, because there are no solutions to drug resistance, there are no solutions to emerging infections, there are no solutions to climate change or mental health without us working together. And as we come out of COVID-19, which we eventually will, the world is going to face a choice, as it has done after every crisis, whether war or epidemics or plague in the past. We're going to face a choice. Do we come together as a world and address these challenges together? Or do we split ourselves into a polarized world where we're fighting each other? And we will face that choice. And our generation will have to make that choice. And I just hope we make the right one that does the right things and brings the world together rather than splitting the world apart.
And Dr Nkengasong, fairly briefly, if you would, on that issue of climate change, from the African perspective, we're already seeing what a huge threat that is to the continent.
Absolutely. Let me perhaps just agree with what Jeremy and the other panelists have said. I think we good public health is the pathogen, the population, and the politics. With bad politics, we risk not working well. I think where we sit at the African CDC and the African Union Commission, we are saying there are 4 C's that we should take care of. One is to cooperate. Secondly, to coordinate our efforts. Then to collaborate, and then to communicate. I think we are very, very, we take these 4 C's very, very seriously, because without coming together and solving our problems collectively, it will continue to be a challenge. These viruses are emerging every year. Over the past 30 years, 30 new pathogens have emerged, and there is no telling of when another pathogen will emerge. We are currently fighting COVID-19, and nothing tells us that in the next weeks or the next months to come, another virus will not emerge. So I think it really requires absolute cooperation and coordination. This virus has taught us that we are more interconnected as a world than we thought. We saw the virus emerge in China, spread through Europe, United States, and Africa. So within a period of less than 4 months, we are all affected by this virus. And the solution lies in coordination and cooperation. I think from where we sit in Africa, we strongly believe in that partnership in solving this global pandemic. It is a global problem. It requires a global solution and a global solidarity.
Okay, what a great message, because we are almost out of time. It's almost it for tonight. But just before we go, I want to take a final straw poll from our hard-working virtual audience by a show of hands for the last time this evening. Simply, I just want to ask you, are you optimistic or pessimistic about the future health of the world after what you've heard this evening? Hands up if you're optimistic. Well, isn't that heartening? Well, I'd say that's almost the whole panel. That's fantastic to see. So tonight we've heard that we have to assume that a powerful second wave of the coronavirus is coming and that it won't go away until the population is immune. Also that we can't assume we'll ever have a vaccine for COVID-19, but that the search for that, and indeed the future of humanity, will require a combined collaborative global efforts. Well, my thanks then to our panellists tonight, Sir Jeremy Farrar, Dr Margaret Hamburg, Dr John Nkengasong and Professor Dame Sally Davies. Thank you so much indeed for your input and your expertise this evening. And thanks too, of course, to everyone in our wonderful virtual studio audience. Thank you all for taking part. All your questions. Quick wave goodbye. Thank you very much. And thank you all at home for watching. Now, tomorrow night, we end our week of special programmes about life after the pandemic with a very special guest.
I mean, I was lucky in my case and got away with it quite lightly. But I've had it, and I can so understand what other people have gone through.
And you can see that exclusive interview with Prince Charles tomorrow evening with his reflections on coronavirus and the future of life and society. Do join us again for that, 8 o'clock tomorrow evening.